In 2017, my older brother passed away from a heart attack. The moments after you lose someone you love can be incredibly dark, confusing, and quiet. This person, this human being that you care so deeply about, has all of a sudden just disappeared from the planet, from your life, and there isn't anything you can do about it. In these moments, I felt stuck, like I was frozen in time, like I was waking up in a world that I had no right to occupy. I was being dragged through life rather than actually being able to live it. I was a shell of a person, trying to hold on to childhood memories in fear of ever letting them go. So, I'm pretty fun. People love to spend time with me. I mean, if you can't already tell, I was pretty much known for just being the type of person that brings the energy up in every room I step into. It's not just you. People do say that about me. People are always like, let's have Sarah over. She's like always talking about the most depressing things. It's great. But all of this loss happened. All of this happened, and I would say I was completely fine. People always ask you how you are when your person dies, and my response was always the same. I said, I'm fine. And I did this because when you lose someone, there's this sudden urge to just rush the process and make it to the finish line. As long as I could survive another awkward conversation with my neighbor, I knew I'd be fine. If I could survive another person asking me if I was actually okay, I knew I'd make it through. I would be fine, and I was fine. At least that's what I wanted myself to think. But I think some people could see right through me. I could even see right through myself. And here's a little secret. I wasn't actually fine. I overate, and sometimes didn't eat at all. I avoided social interactions at all costs. I went shopping with the $4 that I had in my bank account. For the record, you guys, those dollar stores are so underrated. And if you're like me, you'll suddenly unload your pent-up emotions on a complete stranger in the pharmacy. But don't do that. It's completely inappropriate. It was in those moments where I felt utter helplessness because there was absolutely nothing I could do to reverse life cycle of events. I couldn't undo what had already been done. This was more than just feeling sad, and it wasn't linear either. But all of these emotions, this grief that I was feeling, was incredibly messy. And all I wanted to do was shove it into a tiny box and lock it away. So instead of thinking about my loss, I kept moving and I kept going. My grief was kind of like negative inertia, pushing me along. I began to pour so much of myself into other people, and I got involved in so many useless activities to keep myself from thinking about what was actually bothering me. I realized that what I was experiencing wasn't just a moment in time. I was touched by something chronic, something that wasn't fatal, yet it still felt like it could be. Does this sound familiar to you? We've either all seen it or we've all done it. And if you haven't yet, you probably will. What I did was try to make grief into something that was compact, efficient, and even logical. But it's not. Grief is the exact opposite. It doesn't just happen in a vacuum, nor does it always look the way we think it should. I mean, if you ever saw someone who looked like this, would you ever think that she was anything but okay? Wedged between me and the life that I needed to live were a heap of emotions. But the more I kept pretending like these emotions didn't exist, the more I was hurting myself. What I needed was something that would give me another reason to keep moving forward, something that would fill this empty void inside of me. So I put my energy into something a bit more restorative. I focused on voluntary service. In December of 2018, I volunteered at Cannon Orphanage in Mombasa, Kenya, where I met Nikita and the 40 other children she lived with. While conversing with the 2 adults who cared for them, I learned that they each lived on less than $1 per day, and oftentimes they would have to choose between food and healthcare. But what I also learned was that these children are not the only ones. It was in those eye-opening conversations where I realized that individuals living in these third world countries are the ones who miss out on the most opportunity. Because of how this important need of healthcare has been overlooked, many people do not have the confidence or dignity that every human being deserves to discover and reach their full potential and take full advantage of the opportunities set forth by amazing international initiatives. Not only was this such an incredibly humbling experience, but it was my something, and I was determined to build a foundation around it. Yes, a metaphorical foundation, but I also mean a literal foundation. It came as a surprise to me too, but this experience with Nikita and the children living with her completely cracked my heart open. It was through this that I was able to start vahini, a local and globally focused nonprofit organization that delivers medical supplies and health services to developing countries around the world. Yes, me, the 16-year-old girl who could barely manage to get out of bed every morning, was now taking on international healthcare. I refer to our mission as the vahini movement, and I am here today as a proud advocate for it. When it comes to global development and advancing families and working to break the cycle of poverty, empowerment is the key and a major obstacle that stands in front of us. To this day, 3.5 billion people around the world, which is nearly half of the entire world's population, lack access to essential health services. The most sustainable way to overcoming this barrier and empowering those around the world is by providing the people we serve with the healthcare that they need. But healthcare doesn't necessarily mean a doctor in a hospital or clinic providing care to a patient. Healthcare can mean a toothbrush in a child's hand. It can mean delivering soap and hygiene education to local schools. It can mean providing girls and women in need with the menstrual hygiene products that they need most. This is what we do. We provide customized care packages that range from small supplies for personal hygiene to larger supplies that are specifically meant to mobilize health facilities. Through our 3 core pillars, service, enlightenment, and awareness, we strive to elevate the issue of the scarcity that lies within healthcare to eliminate the lack of opportunities available. Our care packages contribute to our pillar of service, but we also start conversations surrounding healthcare and fight to ensure health equity for people in remote communities. But along with our care packages, we also do something that most organizations, no matter how well intended, fail to do. Most organizations only provide charitable aid. But the flaw in only providing charitable aid is that it's a short-term solution, and ultimately, it creates dependency. Once supplies that are provided by a specific organization run out, the people in those areas go back to where they began. We need to make sure that even if 10 to 20 years from now, our organization stops providing direct services, the people that we've helped have a sustained and improved quality of life. So as we provide aid, we'll also foster long-term change by having medical professionals go into these areas to create and teach health solutions with the resources that are already available to the people in that community. For example, Cambodia has an abundance of rice. If we were to go serve the people in that area, we would take what's already available to them, the rice, and we'd show them how to dehydrate the rice to increase digestion and lessen the effects of a certain health problem. This way, even when we aren't physically present anymore, not only have we made long-term change by having the people in that area know how to use what's already available to them, but we've also started this virtuous cycle of healthcare development that can last generations. Not only did starting vahini give me a sense of control, but for the first time, I realized that I had the power to do something. I had the power to prevent another family from experiencing pain and loss similar to mine. And this idea changed my entire life. This act of giving helped heal me. Psychology refers to this as altruism. I call it a grief buster. And research has actually shown that altruistic behaviors increase the welfare of both the benefactor and the beneficiary, especially in cases of trauma, like death. Death has this way of bringing context to life. When my brother died, I was sort of confronted with my own mortality, to a point where I took a different approach in my life. But the world will break you. It certainly broke me, but it'll also make you become stronger in the places that are broken. Sometimes it'll feel like getting out of bed every morning will take the life out of you, or that just having a simple conversation with someone can seem like so much effort. But it's about taking everything that life throws at you, your pain, your sorrows, your suffering, and still putting one foot in front of the other. It's about taking the things that have the power to set you back and turning them into the things that have the power to help you move forward. I will tell you that I'm 17 years old now, and I do all of the normal things that most people do. I work, I go to school, and I spend time with friends and family. By any measure, life is really good, and I'm incredibly fortunate for the things that I have and for the things that I once had. But that doesn't mean my life is complete. It won't ever be. Because we don't move on from the death of our loved ones, and we don't move on from the difficult situations we've lived through. We move forward with them. We take them with us, and we invest it into everything we do. I haven't moved on, but I have taken everything, pharmacy breakdowns and all, and I've turned it into something good. I turned it into something that not only changed my life, but also changes so many other lives. Although my brother isn't physically here anymore, everything about him is still here. He's in the work that I do with Vahini. He's in the people that I serve. He's in the relationships I have with my younger brother, my mom, and so many others. He is here, present, in everything. His life may have unfolded, but mine is still here, and I needed to make something good out of his loss. I needed to put value back into the world, mainly because of the most valuable thing the world had lost. My life lacked a purpose before my brother's life was gone, but his death gave life to Vahini, and Vahini gave more meaning to my life. And this is how I honor my brother, by making sure his death isn't this black hole that sucked me in, but instead is the spark that I needed to be able to burn brighter. And I hope that through the value of the work Vahini is doing, it can help others burn brighter too. Thank you.